Hi everybody, good afternoon. Dr. John Hayes, and welcome once again. Today what I'm going to do is to try to bring your attention, and hopefully the attention of physicians, to an article that was recently published correlating the LDL levels, or the LDL lipid levels, in patients with diabetic neuropathy in particular, to the development of peripheral neuropathy. And I apologize because I'm going to read from the screen a little bit here, but I think the information is valuable enough to share. And as we've spoken about in some of our previous videos, this is a really good opportunity to have a conversation with your doctor too, because this is new for your doctor as well. So this particular article, this reprint of it, actually is entitled "Lower LDL Cholesterol Might Be a Risk Factor for Nerve Damage in Type 2 Diabetes." It's published on MedPage today. The date is May 31st, 2019. And the upshot of the study basically is what they found is that patients that had lower levels of blood lipids, in particular LDL-C, actually had worse peripheral neuropathy. Now, hear me out. Historically, when patients are diabetic, they are very commonly placed on statin medications for a number of reasons, but the thought has been for many, many years that diabetics in many cases should be placed on statin medication because statin medication may very well reduce the complications that result from arterial disease, and that is in of itself true. But here's the conundrum. This study actually showed, and I'm going to read some of this because I think it's real important. It says that both serum cholesterol levels, total levels, and the LDL cholesterol are positively correlated with nerve conduction velocities, which basically says that when there is a low level of LDL-C, or low lipid levels for general terms, there is a higher chance of having more significant neuropathy, in this case diabetic neuropathy. But I think the conclusions of the study are really important to note. And the authors go on to say that, to our knowledge, this study was the first to visualize in vivo, meaning in the body, that low levels of serum cholesterol, specifically LDL-C, were accompanied by peripheral nerve damage in type 2 diabetes. The research group wrote, noting that this study contradicts the results of previous studies indicating that lowering serum cholesterol levels potentially slows the progression of diabetic neuropathy by lowering total serum cholesterol and LDL-C levels, which is what I said a moment ago about statin medication theoretically helping diabetics because of slowing down vascular disease. But the trade-off is this. Instead, our findings are in line with the results of previous studies that found that the intake of statins and decreased serum cholesterol level are associated with neuropathic symptoms, microvascular damage, and accelerated deterioration of peripheral nerve fibers. Again, this is not a mandate to stop statin medication if you're taking it. However, it's, I believe, another good reason to already have the discussion with your physician about statin medications, and as we've talked about time after time after time, doing everything you possibly can, including a plant-based diet on your own, to keep yourself off statins if at all possible. Now again, good healthcare, good medicine is always risk versus benefits. This is not a license. We're not giving you Facebook, Google advice, so to speak, to tell you to be your own doctor here. We are telling you, however, to be your own advocate. You may want to go ahead and print this article, maybe take it to your physician if you have a concern about long-term statin usage, but the reality is that statins can and do save lives, especially in the short term after heart attack. Long term, however, there are more serious considerations. Some patients end up taking statins for a lifetime with no appreciable benefits, but other patients can take statins hardly at all and have very, very serious adverse reactions. I'm reminded of one patient who developed a peripheral neuropathy after a single dose of atorvastatin. Now that's very rare, but things like that can and do happen. Nonetheless, be aware, be conscious about your decisions, be conscious about your medical decisions, and above all, please stay engaged. All right? I hope you found this information more helpful than confusing. But again, the upshot is that statin medications in particular may have a more negative effect when it comes to the development of diabetic peripheral neuropathy than many, many physicians have been led to understand. All right? Have a great rest of your day. Hi, everybody. Darlene, everybody else out there. Thanks so much for watching, and thanks for all your comments about our laser and PBM videos too. We'll be doing more of those as time goes on. All right, enjoy the rest of your day. Take care.